So the objectives of today's webinar are really to talk about some of the concepts and practices which support successful health equity change initiatives. We'll also be exploring some specific examples related to the model which we are going to be sharing today, and talking through some strategies which we can use to engage everyone within the organization. And so we'll focus on a couple of the elements we discussed in that conceptual model. So this webinar sits in the context of a larger initiative. Since May of 2018, the NCCDH has been really hosting an initiative on organizational capacity for health equity action. We've been doing so through a learning circle of researchers and practitioners, as well as through working with 2 public health organizations who are interested in shifting what they do in with relation to very specific health equity change projects. And one of the things which the learning circle members on the practice side identified fairly early on in the process was really the importance of sharing what we were learning through the initiative with the field as early as we could. So as we go through today's webinar, a lot of these ideas, I think, which have just been discussed by the group, so I really want to encourage you to think about the extent to which this resonates with the work you're doing, and also reflect on what is missing in this conversation, which is a question we always ask the learning circle members when we begin a learning circle meeting. And so to ground us in today's conversation, we've been thinking about organizational capacity for health equity action using this definition, which was really developed by a number of Canadian researchers, which is the ability of public health organizations to be able to see health inequities. So the ability of organizations to really identify the problem and then mobilize resources and take action to reduce the observed health inequities. This also links very nicely with the importance of organizations being able to develop the capacity, which includes building the knowledge, the skills, commitments. And as we start to move to what organizations actually do, to actually shift in their systems and structures to enable effective action on health equity. For those of you who attended the first webinar, this image on slide 9 will be familiar. Early in the initiative, we developed what we called a working framework, and we're using this as a guidepost for discussions which the learning circle and the practice sites have. So in the context of this work, we're thinking about 8 elements of organizational capacity for health equity. So this is really like the what of health equity, and this includes governance, leadership and decision-making, resources to guide the work, workforce and human resources, and there you'd see things like, skill and knowledge development. The 4th on the list is data and information. We're also exploring partnerships and engagements, as well as organizational culture. The literature also spoke to the importance of the physical infrastructure within which the work happens, as well as the system boundaries, which really point to things which are external to the organization, but often influence what the organization can or cannot do. Related to this 8 key domains are really the importance of acting at multiple levels, so acting in the context of how people do their work on an everyday basis, so that really individual practitioner level, paying attention to the processes through which work happens, as well as influence what happens at the organizational level. And at the organizational level, we're thinking about things like organizational strategies, organizational policies, and organizational values. For today's conversation, we're going to be talking specifically around the change capacity of organizations. And so the change capacity of organizations was the subject of one of our very early learning circle conversations. And so there we started talking about what does it mean, what do organizations need to look like to change. And we'll spend the next couple of minutes with you talking through that idea. Before we move further, I'd just like to get a sense from everyone on the line where your work fits. So we have 5 of those 8 domains which I just mentioned briefly, and we're going to put up a poll here. So are you currently involved in a health equity change project? And if you are, does your work fit in some of these boxes? So is it related to governance and leadership, data and information? So actually, of course, we can get the poll up. That would be great. Thank you. Or is it related to partnerships, which can include multi-sectoral collaboration or community engagement? Are you thinking about resource allocation in the context of your work? And is your work completely related to something completely different? If it is, please share that with us in the chat box. Great. So I'm seeing here about half our group here today is doing a lot of work in partnerships and community engagement. About a quarter of the group is looking at data and information. About 20% focusing on governance and leadership. I'm seeing 0 in terms of resource allocation, and a little group looking at workforce and human resources. So a bit of a mix in focus here. Thank you, Ashikor. So as we go through today's presentation, I'd like to encourage you to think about how the ideas and concepts being discussed link specifically to the work you're doing. So what do we mean by organizational change capacity? As we started looking into this work for the Learning Circle, we normally do this really strategic scan to the literature, just trying to figure out what is the evidence related to this issue. What we quickly found as we started doing our searches is that the evidence which links organizational capacity is not very robust. So we quickly moved into literature which is looking at public health more broadly. Our group explored this framework by some researchers associated with the World Health Organization. And so they define organizational change capacity as the ability of an organization to develop and implement change and adapt to an environment which is constantly changing. And I really want to flag that constant change because for those of us in the health sector, pretty much most of us on the line today, we know that we're working within organizations and systems which are always shifting. So really the ability to adapt to that change as it happens is a key component of organization, the capacity of an organization to change. They also talk about this being related to being relevant, whether or not this change has been driven by factors external to the organization or whether or not it's been initiated from within. In their change model, they talk about 3 main dimensions, which we'll go through in some detail. They talk about the organizational context of change, which is really the environment within which change happens, the change process, which is how change happens, and the learning dimension, which is the ability of the organization to actually learn and use what it's learning in its everyday work. I'm going to spend the next couple of minutes walking us through these 3 dimensions. And as I do so, I'm going to share a little bit about how the Learning Circle was engaging with some of these ideas when we met. So the authors talk about, Turner and al. In their model, talk about the context of change, which, as I mentioned, is the environment within which change happens. They speak to the importance of the value of change. And so in their work in developing this model and applying it to the context of the World Health Organization, they talk about the extent to which staff within the organization think the change is important. And so when employees or staff believe that the change is important, this really shapes the behavior. And if staff feel like the change is more important, then they're more likely to initiate and implement changes which are being suggested through this change process. The organizational structure itself makes a big difference. So in organizations which are more flexible, these organizations tend to support staff discussion and engagement around health equity change initiatives. Also related to organizational context is really the culture of the organization, and a related piece to culture is the level of trust which exists. So in organizations where there's a really strong organizational culture and staff feel a strong connection to each other as well as to the organization, there tends to be a greater commitment to the changes being proposed. And also in terms of trust, so trust really speaks to the person who is the main change driver, so say the leader who is putting forward this change effort. So in cases where the person putting forward a change process, a change initiative, is a trusted person, they're in the position to move change more rapidly throughout the organization. So still related to the organizational context is really the sense of being able to make decisions together. So there on the screen it shows that that's consensus basis. So is there a culture that supports collective problem solving and generating solutions together? The last bit Kenneth and colleagues talk about in relation to organizational context is the ability of individuals within the organization to actually learn and adapt to the change, and in doing so, change the practice of their everyday behavior. So when we discuss this in the Learning Circle, for a lot of members in the Learning Circle, these pieces in the organizational context really resonated with them. I think our group really highlighted the importance of leadership as a key driver. So the group spoke really strongly to the importance of having leadership, senior leadership support for the work, and how senior leadership support really opened up the space for others within the organization across all levels to then develop that commitment. Leadership is also really important with in terms of assigning resources to the work. So senior leaders are usually in the position to allocate resources for health equity change projects within the organization, which others in the team don't have that same degree of flexibility. I'm now going to move and talk a little bit about the processes of change. So I'm going to speak about 5 processes more specifically. So starting with transparency, which Samiya is going to go into some detail later in the presentation. So in terms of transparency, it's really important in health equity change initiatives for there to be a common and shared vision for change within the organization. So, and this is really linked to very strongly to communication. So ensuring that as the change is being envisioned, as it is being implemented, and as things are progressing, that information is really being shared across the organization in multiple ways, and in ways in which people both internal to the organization and external to the organization could contribute to it. Transformational leadership is also thought to be a really important part of the change process. And so often you would have a leader who was able to galvanize and get people within the organization who had the power to make change. They speak about the importance of developing, what I call a coalition of support. So being able to build a team of champions across the organization who can then go out in the organization and share that common message of change within different teams, and ensuring that consistent messaging. The authors also speak about incremental deployment. So oftentimes when we think about change, it can happen in multiple ways. So change can happen slowly over time. And the work Kenneth and colleagues have done really suggests that change happens over time, which is slow and step by step, provides enough time for staff within the organization to be able to learn new skills, learn new knowledge, and then have time to actually adapt it into their everyday practice. Now we can contrast that with change which happens fairly rapidly, where maybe you're within an organization and all of a sudden you get a notice one morning saying, hey, we now look very different and we're going to do our work very differently. In cases like that, that kind of transformation is often a lot harder for staff within the organization to implement because it is a bit more disruptive to everyday processes. And so incremental change often helps maintain stability while change is happening. I want to speak a little bit about collectively built processes. I'm going to get into that in a moment in a bit more detail shortly. And so collectively built processes really relates to employee involvement. So the sense that everyone in the organization is in the work together. So creating processes for people across the organization to get involved in the work in different ways. And I think this also calls on organizations to move beyond the discrete roles and open up spaces for people to contribute in ways which may match their roles or their talents as well as their interests. And this also supports discussion. It enables collective problem solving and learning between members across the organization. So I have a question for you. As you've heard me talk through some of these change processes, transparency, transformational leadership, which helps build commitment, the importance of building processes together, as well as incremental deployment. Can you see some of these elements in the work you're doing? And if these are not present, have you used these processes for other issues? So when we start recruiting public health organizations to join this particular initiative, one of the questions we asked was, have you been involved in an organizational change process? And it did not have to be related to health equity specifically. But the reason we asked that question is because oftentimes we can actually adapt what we've done for other issues to our health equity work. And I say adapt because it's not always possible to transfer things in their entirety, but we don't always have to completely throw out what we're already doing. There are things which we can sometimes tweak so that it fits the purpose of health equity change work. So, Ashiko, can we pull up the next poll? I have a question for participants. Thinking about the work you are currently involved in or have been involved in the past, specifically related to health equity, have any of this shown up in your work? All right, so I'm seeing some great examples here. So lots of people are saying they have seen, they have transformational leadership presence, they see a commitment. I'm also seeing here that the external partnerships present, employees have been involved. So I just like some of those options. I'd love if you could share some examples. So for folks who are saying transformational leadership has been present, can you share an example of what transformational leadership has looked like in your context? And similarly with the other processes there. And if you have any resources related to those, it would be great to see them too. Thank you, Ashikor. So I think your responses are really resonating that these are all important elements to think about as you embark on a health equity change initiative. In the planner document, one of the things you see is what they call a capacity profile, and we have the reference at the end of the presentation. And that is a really nice tool just as you're starting a change process to just take a minute to reflect on whether or not you have those different elements in place. And for those which you have, how do you highlight them? For those which you have to a certain extent, how do you strengthen them? And for elements which may be missing, what kinds of activities can you take to actually make sure that you build those into your processes? So on the Learning Circle, we had a call where we spent some time specifically on one of the processes which we just mentioned, which was collectively build processes. And so this really speaks to the importance of avoiding a top-down approach, kind of speaks to the importance of making sure that everyone in the organization is involved in the change process and in thinking through the implementation as well as the implementation itself. This involves making sure that people across all levels of the organization are involved in an ongoing discussion, in problem solving as well as in learning. And one of the things in their analysis they found when we were looking at the World Health Organization example is there were cases where the change was really coming from the top, and employees were not integrated even though there may have been mechanisms. So they point that out as a gap, ensuring that while leadership support is important, it's important to also have employee views incorporated from the very beginning and throughout the process. And they also speak to the importance of engaging external stakeholders. And so here you start to see some really nice links between the capacity of an organization to change and what I talked about earlier as in terms of community engagement. So there's a really nice interplay between what happens within the organization and how organizations engage people external to their own walls. In our little evidence scan, one of the things which came up, which Clenna talks about, is we talk about the role of middle managers. So a lot of the times in our work, we speak about leadership at that high level. And in the work we've been doing at the NCCDH, we've really been promoting this idea that everyone leads and that we all lead differently. And so in the literature, there's a little bit of a conversation on how middle managers can act as change agents. And when I speak about middle managers, it's not really a very firm definition, but it's really thinking about people who are not necessarily leading the organization at the very top, and who are in the middle and responsible and engaging with staff across the organization or in teams. And so middle managers play different roles, and those roles can be strategic, so really helping to guide that vision and share the vision across the organization. Middle managers also play a really important role in implementation because they are the ones who are often overseeing the day-to-day operations within organizations. So they play a bit of an administrative role and an operational role. And they also play a leadership role in getting the vision, promoting that vision to other people. We talked about some examples where middle managers were really the ones who are driving the change and saying this is an important issue which we need to be paying attention to. Middle managers also play a role in terms of decision making and communication, which I spoke to a little bit already. In our scan, we identified a resource which was developed by Peel Public Health, and I see that we have some folks from Peel on the ground, so if you'd like to share how this framework is being used, that would be great. And so Peel Public Health a couple of years ago undertook a scan. It wasn't related to health equity specifically, but it was related to how middle managers could effectively lead complex change within the organization. And in that scan, what they found from the review was that middle managers needed to both understand what happened at the individual level as well as the organizational context for change. They spoke to 3 broad practices which managers could take. And so that included engagement in dialogue, so really having deliberate and planned conversations with teams. They talked about the importance of managers reframing the work. So as work is changing, being able to communicate to their teams about what changes were going to happen, how those changes link to the organization's mission and objectives, and also designing the processes which were going to be used for change. So if you think about sort of reframing work, a great example is the equity-focused population health status reporting. So if you're on a team and thinking about how you change what you do in terms of your regular reporting, middle managers can then say, well, this is what we currently do, and this is how our work will change concretely. And so in that sense, middle managers would then be refining the process through which work happens, and also setting standards which people on the team then have to follow in the everyday context of their work. The third practice this review from Peel spoke to was the importance of clarifying roles. So oftentimes as organizations implement a range of health equity projects, roles on teams sometimes shift, and roles may have to shift to align to new priorities. The roles may have to be aligned to different kinds of values. And so as a middle manager, part of that in terms of the task is thinking about how the shift in roles may change what people do on a daily basis. So what are the requirements of the job? Right? So how do you do your work differently? And again, relating those new ways of working and those new tasks to organizational goals and the mission. They also speak about the more person-based behaviors which relate to sort of communication and explaining how the new roles link to a new way of working, and also validating the issues and interests of employees. So oftentimes, when change can be very disruptive on a personal level. So because for a lot of us, it means letting go of things which we have done for a very long time. And so managers can often play a role in listening to those concerns and addressing them on an ongoing basis, and really validating those concerns as real and important. So the last thing I'm going to speak about before I pass it on to Samiya is the third dimension, which Clenna and colleagues talk about, which is really the importance of learning. And so for us as a knowledge translation organization, it was really great to see learning take such a central stage in terms of organizational change capacity. And so Clenna speaks about 3 dimensions of learning, which are experience, experimentation, and knowledge translation. And here, experience is really the sense that we learn through doing, and being able to adapt adapt for staff being able to go through and adapt their work. That was really important for to sustain change on a long-term basis. So as you applied, you shifted, and as you shifted, there's a little bit of experimentation in the work. And for experimentation, there was speaking to the ability to incorporate new ideas into the work. So in the work we've done at the center, we talk about the importance of a learning culture. And in organizations which really have a strong learning culture, it's often easier to implement some of this change, so new ideas can be brought in and flow through. A few years ago, we conducted a review of sort of equity-oriented knowledge exchange and what supported that work. And so we found that there were 6 things which were really important. So if you think about knowledge translation and exchange as you're undergoing some health equity change work, our work really pointed to the importance of having equity as an explicit focus, also incorporating different ways of knowing. So think about evidence in a broad way. So that could be research, it could be the knowledge practitioners bring to the work, it could be community-based knowledge. Health equity change often benefits from and really requires participation from community members who are most affected by the issues we're trying to address. And also, it's really important to bring in perspectives and engage across various disciplines and various sectors. Knowledge production is really important. So really interrogating the context within which knowledge is generated. So as we think about knowledge, who created that knowledge, and how is that influencing what we know or what we don't know, as well as the kinds of questions which we ask. And the last I mentioned, which you'll see has really strong resonance with what I shared already, is being able to apply a problem, take a problem-solving approach to the work.